Patient has a nice even gait with easy movement. Handshake with firm eye contact was established. I introduced myself to the patient, asked her why she was seeking care, explained to her I would be assessing her neurological system, and checked her armband for identification. The patient hears and understands me when I speak English, has no issues with vision, can sit, stand, and rise with ease, is interested and involved with her care, dressed appropriately, mentally alert, and I can tell because she is able to repeat 3 unrelated objects such as dog, box, and couch. She's oriented to time, person, and place, shows no signs of shortness of breath, and appears to be of healthy weight. I have all my proper equipment, tuning fork, reflex hammer, tongue blade, paper clip for sharp sensation, and then everything for my vitals. For vitals, I would take respirations, blood pressure, temperature, pulse ox, height, weight, BMI, pain, and visual acuity. For history, I would get patients' biographic data by asking name, date of birth, occupation, gender, marital status. I would get the reason for seeking health care by asking about her chief complaint and the history of present illness by assessing that chief complaint using old carts. I would get past medical information by asking about recent surgeries, hospitalizations, accidents, immunizations, last exam, childhood illnesses, obstetric history. I would get present health information by asking about present health conditions she may have, medications taken, and allergies. I would get family information by asking if any chronic medical conditions run in the family, asking about family and social relationships. I would get personal information by asking about personal status, illicit drug use, smoking, diet, environment, functional ability. I would get psychological information by asking about health promotion and mental illnesses, and then I would do a review of systems, getting general symptoms, head and neck, integumentary, respiratory, chest, breast, cardiovascular, GI, GU, reproductive, musculoskeletal, nerve systems. I would then prep the patient for the exam, giving her a gown, asking if she needs to go to the bathroom, taking any specimens if needed, and just having her sit on the table, getting ready for the doctor. So I would start my assessment by testing deep tendon reflexes. So I would do triceps, biceps, patellar, and Achilles. I'm just going to lift up her ankle. I would then observe the eyes for extraocular movements to test the oculomotor, trochlear, and abducens nerves. I would go from the top to the bottom on one side, top to the bottom on the other side, and then side to side, just watching her eyes and making sure the movements are symmetric. I would evaluate the face for light touch and sharp touch. And that would be testing the trigeminal nerve. I would then have the patient raise her eyebrows, smile, puff out her cheeks, purse her lips, show teeth, and then close her eyes while I tried to open them, and that would test the facial nerve. I would then test the ears for hearing using the Rhine test. I'd put it on the mastery process until she can't hear it, and then move it in front of her ear. And then I would do the Weber's test to evaluate the acoustic nerve. I'd put it on the top of her scalp, ask her which ear she can hear it in the most, and then I would inspect the oropharynx for the gag reflex, and that would test the glossopharyngeal and vagus nerves, and then I would have her say ah, make sure the uvula rises. Then I would test the shoulders for strength and symmetry. While she raises her shoulders, I would be pushing down, and that would test the spinal accessory nerves. And then I would have her stick her tongue out, move it up, down, side to side, checking for symmetry and lesions. And that would test the hypoglossal nerve.